session on a case-based session, workshop for atypical parkinsonism, and also talking about some Huntington's disease lookalikes and Huntington's disease. So this was an excellent session. I had two colleagues with me. Maria Stamelu, she opened the session and she spoke about atypical Parkinsonian conditions, how to differentiate multiple system atrophy from progressive supranuclear palsy, from corticobasal syndromes, and really gave a very excellent overview about the pathology, the clinical phenotypes, and that this is a syndrome, or rather these conditions are a syndrome and can be caused by many different pathologies. And that sort of set the flow for me as the second speaker, and I talked about what we now describe as atypical Parkinsonism. So what that means is that there are conditions which may resemble some of these disorders such as multiple system atrophy or PSP, but underlying pathology or genetics is different. And that I showed them a number of examples of cases who had been diagnosed as a particular disorder such as MSA, for example, but turned out to have a Fragile X premutation or some other condition. Similarly for PSP, there were patients who look like PSP but who have dynactin gene mutations or have Gaucher's disease. And the reasoning behind this and the importance of this session was that we are trying to find treatments for these rare but difficult disorders which affect a lot of people. And if we don't get the diagnosis right, and we are mixing up conditions from just the clinical perspective while the underlying pathology or genetics is different, then we will not be able to find the right treatments. And a number of drug trials in these conditions have failed, and in my view it's very important therefore to get the clinical diagnosis right, and this is what I was talking about. And in the same vein, following me was Professor Roos, and he talked about disorders which look like Huntington's disease but may have other conditions, and again both from a prognosis and from a treatment perspective, this might be very important that people are able to recognize these different conditions which may mimic each other, at least superficially, clinically. So the point of the whole session was well taken, I think, and people were able to now be able to see in their practice, and we gave them some references of the literature they may look up to help them formulate their thoughts about this and how to approach a patient and how to investigate a patient clearly. So I thought it was quite a successful workshop, and I'm hopeful that the audience thought the same.